All right, good morning. Welcome back to Kuleana Community Talk Story. As a reminder, we have the QR code for you to do the evaluation after today's talk. We'd like to thank our sponsors again, Kilohana, Chancellor's Office, Center for Global Exchange and Education, and a few other faculty and staff. Today we have a very important topic. Um, Dr. Angie Dickson is a clinical psychologist. Born and raised in Kailua, Hawaii, and is the executive director of Care Hawaiʻi, and is going to talk about no
Crisis services.
crisis services. And we'll be talking about services available here in Hawaii. So without any further ado, Dr. Angie.
Thank you.
Hi, everyone. So we're just gonna talk about crisis services here in Hawaii. So I'm with an organization called Care Hawaiʻi, and we're contracted through the Adult Mental Health Division. And we have services on all of the islands, well, most of the major islands. And we're a behavioral health company. So I just have some statistics from 2021, just about the need in Hawaii for mental health services. Um, so I guess it's important to note that in 2021, 187,000 adults were diagnosed with or have a mental health condition. I think it's important to note there, though, that it's usually underreported. So I'm sure we all know people who may be suffering from anxiety or depression, but they're not being treated for that. I won't bore you with all the statistics. One of the other important things to know is a lot of people who come through the mental health system, they also have been arrested by police or have been put in jail or prison. I think there's been a big push lately to kind of try to do preventative services with the youth in Hawaii as well. So we have some statistics there. And then in Hawaii, um, a lot of the homeless population, about 1 in 4, have a serious mental illness. I would guess that number is also higher because it's also an underserved population. So those statistics are from NAMI. Sorry, I have to see it on the screen. So these statistics are available to anyone, by the way. If you go on the Department of Health website for Hawaii, they run these statistics every month. And so these are the number of discharges related to mental health disorders. So about 4,549. And that was for 2024. And then, so I don't know if a lot of you know about, oh, it didn't switch here, sorry. The Hawaii Cares line, but there's a national crisis line, which you can access through 988. And the total, so anybody can call this number if you're in a mental health crisis, if you need behavioral health services. So in just the last 2 months, that service has routed 10,000 calls for just January and February. And February is not even over. And this is just for Hawaii. So to help combat the crisis and mental health issue in Hawaii, the Adult Mental Health Division initiated what is called the Crisis Continuum of Care. So what they've tried to do is streamline crisis services in Hawaii so people can have access to resources faster. So the crisis continuum includes the crisis hotline, which is the national 988 number, the crisis mobile response team, and then crisis stabilization facilities. All of these services come under the Adult Mental Health Division, Care, SAMHSA best practices, and the model that they adopted is the crisis continuum model, which actually came out of Arizona. So they went there and they kind of studied how that system works, and they brought it here to Hawaii. So your regional crisis call center is the 988 hotline. So anyone can access this. They can call, they can text, they can chat. It's staffed 24/7 by clinical crisis staff, so people who are trained to address crisis and mental health. They do telephone support, text support, chat support. They follow the National Suicide Prevention Lifeline standards, and they coordinate with crisis mobile outreach and crisis stabilization facilities. So if somebody calls 988 and they're like, I don't feel safe in my home, I need somewhere safe to go, they'll send somebody out. the crisis mobile response team to come and assess them in the community, and they will take them to get help, whether that's, you know, going to the ER to get assessed or taking them to a stabilization center where they can have some time away from home. Crisis mobile outreach, also known as CMOs, they're available to anyone in the community at their home, at their workplace. They go out at any time of the day. You can call them at 2 a.m. and they'll send somebody out to you. Their job is to respond to anybody in the community who has crisis to help stabilize them by connecting them with other services if needed, or by just providing therapeutic support. They can if there's an unsafe situation, they can outreach with law enforcement. However, they do try to outreach without. But if it's if it's something dangerous, we also are called by police to come out to kind of help. And they're also able to schedule follow-up with outpatient and any other community supports. One of the supports that, sorry, this is just more. So they do triage and screening assessment. They help de-escalate situations. They provide peer support. They communicate with medical and behavioral health services. So like if somebody has a case manager or a psychiatrist, they might call them just to coordinate care. Or if it's like a family member, they might meet with their family to help them come up with like a safety plan. And then they do follow-up. So one of the follow-up services they offer is called crisis stabilization management. So that provides a longer-term stabilization of a crisis. And basically what you're getting is 30 days of services with someone who's like a case manager who can meet you in the community and help connect you to resources. So that person can help you connect to long-term case management if you need that. They can help with housing referrals and placements, substance abuse referrals and placement, and they can also help them connect with community resources like Social Security, DHS, or getting medical insurance. The other service that they're able to connect people with are stabilization beds. So that's the third part of the crisis continuum, is having somewhere somewhere that people can go. So these are usually residential units, so houses in the community. A person can stay there for 10 to 14 days. They enter through the 988 CMO system. That provides even more support. They usually have a medical staff, and they also have behavioral health staff to help assist the person while they are staying there. So in Hilo, we have one LCRS. It has 8 beds. A person can stay 10 to 14 days. So it's kind of close to here, actually. But yeah. And then in Kona, we have what's called a stabilization intensive case management facility. So they have 8 beds too. They are also in Kona. People can access it through 988. And the length of stay there is 14 days, but it can be extended longer if needed. And all of these services can be accessed through 988. So anybody can call and get those services. Another thing that we have, so recently on Oahu, they opened the Behavioral Health Crisis Center. And that's something that's actually in the works for Hilo. I think Hawai'i Island Community Health Center is looking into opening this facility. And so this, I guess, helps reduce some of the barriers that people have to treatment, like having access to a provider. So the behavioral health crisis centers take people, and there's a no wrong door policy. So some of the stabilization beds, you have to meet certain criteria to get in. Like you must be in a mental health crisis. You have to have your chest X-ray or TB done for licensure requirements. The BHCC, however, because you have providers on site and because they have an observation unit, which is 24 hours, anybody can come in. So you can just be like, I'm here just because I'm anxious because I'm homeless, and they will let you rate it. So they have a no wrong door policy. Because they will be staffed with a psychiatrist or an APRN, they will have access to like getting medications if they need it, or being assessed and having a psych eval done. And also it can help with physical needs. The BHCCs are always staffed 24/7 with an APRN nurse, a licensed clinician, a case manager, behavioral health workers, and peers with lived experience. And they also provide streamlined access to support beds. So this is just the numbers for Big Island. So this is the past year, and in 2024 there were 1,237 outreaches done by 988 to assess people for placement and for services. So in Hilo, and this is from January. So in Hilo, there were 108 calls to the crisis line, 15 admissions to our LCRS, and then 4 that required intervention to the ER. Lower, so 20 and then 6 admissions. They actually drive them over to the LCRS here at Hilo, and then only 1 of them resulted in an ER visit. So part of the, I guess the reason that a CMO is initiated is to try and reduce ER visits and try to reduce people going through the jail, through the jail system, and providing that support to them in the community so that they can be helped without having to go through that. So, do you guys have any questions? I know that was a little quick, a lot of information. Yes.
Wait, why do you think the Hilo and the Kona signed the number of the
I think that it's population. So like I think some of the services, like definitely in Kona, there's not as many services. So I think people know that, and so they might go to get community support. So usually when we get someone who calls in, they already know about the licensed crisis residential shelter, and that's where they want to go. So they'll call and be like, I want to go there. So they're kind of aware of the services. I think Hilo definitely, you guys are, so as far as ER visits go, Queens is number 1 for mental health visits, and the Hilo hospital is number 2 in the state. So there's a lot of need in Hilo itself, and that's why I think they're trying to open the BHCC for Hilo. Because people always are like, well, why shouldn't it be in the middle or the other end? But the need is actually here. Yes.
Are there CMO teams that are dedicated to youth specifically?
Yes. The CAMD also partners with us. A lot of the youth services go through the family treatment centers. Yeah, but yes, it's part of the contract, but it's a smaller contract here because I think they go through the FTCs.
Is that the decision that she has made at 988?
Yes. So yes, you can even call 988 for youth, and then they will connect you with a youth CMO.
And then you cut off at 18. Is that kind of
It's 18 or if they're still in school. So the youth services through CAMD, if somebody calls and let's say you have an 18-year-old in high school, they'll still send out a CAMD worker. For youth services, it automatically comes with a 30-day follow-up as well. So for the adult services, you have to ask, you have to say, I want 30 days of follow-up, and then, it's voluntary. But for youth, it's automatic.
Let's give her a hand. Thank you.